Good morning, guys. We're all sparkly. A quick little video before work. In the last week, 2 patients have told me that prior to TRT, they were suicidal. And what's made the difference? Yes, testosterone. But testosterone carefully titrated according to response to make sure that they stay within normal physiological parameters for long-term physical and psychological well-being, because it's all about what? Yeah, balance. Understanding the need for contrast in order to establish harmony. Yin and yang, baby. So, wow, isn't that scary? Scary for lots of reasons. One, perhaps, because suicides are common, way too common. And who looks to check testosterone in mental health? No, nobody. Now, we know that testosterone plays an important role in mental health. So why don't we test for it? Well, we're going to give them SSRIs and talking therapies because, I don't know, Jesus. Give me strength. So, we talk about the emphasis being physiology before psychology, before emotions. And what do we concentrate when we've got mental health problems? Yeah, emotions. And our emotions betray us. Our emotions want us to stay safe. They don't want us to go out there and hunt and be productive members of society. They want to stay in, isolated, away from the dangers. So we shouldn't trust our emotions. With low testosterone, it's hard not to trust your emotions because your physiology has let you down. You have low mood because testosterone, estrogen and DHT are not effectively in parts of the brain that are necessary. You've got tiredness, you've got brain fog, muddled thinking, your libido's low, physically, you've got erectile dysfunction, you seem to be shrinking, gaining fat despite your best efforts to maintain a healthy lifestyle, diet and training. So what's the point? And what is life without hope? If you put the effort and you don't see the reward, what on earth is the point? It's a very valid question. So what should you do? Yes, you should be courageous and ask for help. If you've sought answers and not found them, you have to keep going. I'm going to say you're going to have to man up. Mental health professionals and advocates across the world say, you can't say those words. I don't mean man up as in, I don't know what you mean by that, but I mean move forwards. Be manly. Because purgatory is not a place you want to stay in. And you've listened to your emotions for too long. We need to be productive members of society. We need to go out and hunt. Because I've said this before numerous times. Physiologically, we are hunter-gatherers. We should wake up with high testosterone, high cortisol to be physically active. To be more sympathetic, fight or flight during the first part of the day whilst we're hunting. To attain our reward, which is food, to then transition into a more parasympathetic state before sleep. Rinse and repeat. Your testosterone levels follow a diurnal pattern. Day, night, day, night, day, night. They don't care if it's the working week, the weekend. They don't care if you're upset. They don't care if you're happy. They want you to do the same thing day in, day out. Hormones are chemical messengers that help facilitate the function of their target organs. They form the foundation, the base, to then allow your autonomic nervous system to work effectively, and the noggin, to work effectively. Without the base, you are fighting a losing battle. And we don't want you to fight a losing battle. So sometimes reaching out for help, asking for help, is 100% the right thing to do. So saying man up does not mean pull the drawbridge up. No, it means actually be courageous and move forwards, because life is about movement. And this is what we need to understand. So we talk about making positive choices and rewarding ourselves for these positive choices, and rewarding ourselves for not engaging in negative behaviors. We explored this last time. Be the director of your own real-time movie. Be the hero. Apply a level of objectivity to your subjective experience. So when you are faced with challenges, and we are faced with challenges because we're overstimulated, oversaturated with bollocks, and we've made bad choices in the past because we've always gone to the path of least resistance, because we're interesting, that's a survival thing. Why would you take the long route when you can take the short route? But we've done it wrong, haven't we? We've sought pleasure through hedonism, not work. And what do animals do when they wake up? They work. They don't take, they work. And when you go to the doctor and you've had this paternalistic relationship with him for so long, and he doesn't give you what you want, what do? You give up. But you can't give up. You've got to keep going. Lots of you have resisted the antidepressants and Viagra, seeking answers. You've looked at the internet. You found people saying, yes, TRT will make you a god. TRT will just give you muscles. It will just improve your libido. That is false. It can, but it's not an assumption, because these things are multifactorial. They are more complex than simply normalizing your testosterone levels. Because fundamentally, we go here again one more time. They are the base to allow you to put the work in. They are the base to allow you to earn your reward. But only you can do that. You can still decide to see a glass as half empty. You must decide to see it as glass half full. You don't want to put the work in. You won't see the reward. TRT won't work for you. You can be on TRT for years. You can have optimal levels and go, TRT's not working. What's the excuse? Nobody cares about the excuse. Look for solutions, look for answers, and go forth. Again, move forward. TRT is not a cure-all, fix-all. If it was, it would actually be disappointing. Because if it's about anything, life, earning your reward. Fundamentally, this is the key to success. I can tell who's going to be a good patient and who's going to need work. Guiding. If you're motivated, if you're driven, something difficult with low testosterone, but if it's all here and you want me to unlock the key, we can unlock the door, but you still have to walk through it and put the work in. How often do you need to do it? Yeah, you guessed it, every day. I do take massive inspiration from people like Goggins, but you still have to realize he's a human being. But it's all about balance. So never trust anybody 100%, because we're all human, we're all fallible, we all make mistakes, but we're all on this journey together. Hopefully learning, hopefully evolving. I'm in a very privileged position, having listened to your stories, well over 2,000 to date. And it allows me to allow a bit of objectivity in your subjective experience to say, right, do this, do that. Whether you choose to do it or not is entirely up to you. But I want you to get better. I want you to go forth and earn your reward.